Sexual health is a fundamental component of overall human well-being. It involves the harmonious functioning of the reproductive organs, endocrine system, nervous system, cardiovascular system, and psychological health. Although sexual health is an important part of quality of life, many people hesitate to discuss symptoms related to sexual function with healthcare professionals. Embarrassment, stigma, and lack of knowledge often delay medical consultation. From the perspective of clinical urology and andrology, sexual symptoms are not only issues of intimacy or performance. They may also serve as early indicators of systemic disease. Condition affecting blood vessels, hormones, nerves, and reproductive organs can first appear through changes in sexual function. Urologists frequently encounter patients who ignored symptoms such as erectile dysfunction, pelvic pain, testicular discomfort, or abnormal ejaculation for months or even years before seeking care. In some cases, these symptoms were linked to significant medical conditions including cardiovascular disease, hormonal disorders, infections, or structural abnormalities. Recognizing warning signs early allows physicians to diagnose problems sooner and begin treatment before complications occur. This educational script explains 7 important warning signs that may indicate your sexual health requires professional medical attention. The goal is to improve awareness and encourage individuals to seek evaluation from qualified healthcare professionals when necessary. Warning sign 1. Persistent erectile dysfunction, one of the most common conditions evaluated in urology clinics worldwide. It is defined as the consistent inability to achieve or maintain an erection sufficient for satisfactory sexual performance. Occasional erectile difficulty can occur in healthy individuals due to fatigue, stress, alcohol use, or temporary psychological factors. However, when erectile problems occur frequently or persist for several months, they may indicate underlying medical conditions that require investigation. The physiology of erection depends on proper coordination between nerves, blood vessels, hormones, and smooth muscle tissue within the penis. Sexual stimulation triggers nitric oxide release, causing relaxation of penile blood vessels and allowing increased blood flow into erectile tissues. Conditions that interfere with blood flow are among the most common causes of erectile dysfunction. These include atherosclerosis, hypertension, diabetes mellitus, and elevated cholesterol levels. Because the penile arteries are smaller than coronary arteries, erectile dysfunction may appear years before symptoms of heart disease. Hormonal imbalances may also contribute. Low testosterone levels can reduce libido and impair erectile function. Neurological disorders such as spinal cord injuries or neuropathies may disrupt the nerve signals necessary for erection. Psychological factors including depression, anxiety, relationship conflict, and performance pressure may further worsen erectile symptoms. Persistent erectile dysfunction should always be evaluated by a physician. Diagnosis may involve medical history review, physical examination, blood tests, and sometimes specialized vascular studies. Treatment options may include lifestyle modifications, medications, hormone therapy, counseling, or other advanced therapies depending on the underlying cause. Warning sign 2. Pain during sex or ejaculation. Pain during sexual activity is not normal and should never be ignored. Discomfort during erection, intercourse, or ejaculation may indicate infection, inflammation, or structural abnormalities within the reproductive organs. One common cause is prostatitis, an inflammatory condition affecting the prostate gland. Prostatitis can produce pelvic pain, painful urination, discomfort during ejaculation, and sometimes urinary symptoms. Another potential cause is epididymitis, which involves inflammation of the epididymis. This condition may result from bacterial infections or sexually transmitted infections. Symptoms often include scrotal swelling, tenderness, and pain that worsens during ejaculation. Urethral infections and urinary tract infections. Evaluation by a urologist typically includes physical examination, urinalysis, and sometimes imaging studies or prostate evaluation. Early treatment helps relieve symptoms and prevents chronic pelvic pain syndromes. Warning sign 3. Loss of sexual desire. Sexual desire, also known as libido, is strongly influenced by hormones, psychological well-being, and overall physical health. A persistent decline in libido may indicate hormonal imbalance, particularly low testosterone levels. Testosterone plays a central role in male sexual function, influencing desire, energy levels, muscle mass, and mood. Other endocrine disorders such as thyroid dysfunction can also affect sexual desire. Psychological factors including stress, depression, and relationship conflict frequently contribute to reduced libido. Certain medications, including antidepressants and blood pressure medications, may influence sexual interest as well. Evaluation by an andrologist may involve hormone testing, psychological assessment, and review of medications. Treatment strategies depend on the underlying cause and may include hormone therapy, counseling, or lifestyle adjustments. Warning sign for ejaculation disorders include premature ejaculation, delayed ejaculation, and inability to ejaculate, heightened sensitivity, or neurobiological causes. Delayed ejaculation involves significant delay in reaching climax despite adequate stimulation. In some cases, ejaculation may not occur at all. These conditions may be influenced by neurological factors, hormonal imbalances, psychological stress, or medication side effects. Professional evaluation helps determine appropriate treatment, which may include behavioral therapy, medication, or counseling. Warning sign 5. Changes in penis shape or curvature. A noticeable change in penile shape or curvature during erection may indicate a condition known as Peyronie's disease. In severe cases, curvature may interfere with sexual activity. Peyronie's disease may develop after minor injury to penile tissue. Although exact causes are not always known, urologists diagnose the condition through physical examination and sometimes imaging tests. Treatment options range from medication and injections to surgical correction in severe cases. Warning sign 6. Testicular pain or lumps. Testicular discomfort, swelling, or lumps require prompt medical attention. These symptoms may indicate infections, cysts, varicoceles, or rarely testicular cancer. Testicular cancer is one of the most treatable cancers when detected early. For this reason, physicians often recommend regular testicular self-examination for early detection. Other conditions such as varicocele involve enlarged veins within the scrotum and may affect fertility. Any persistent change in the size. Warning sign 7. Blood in semen or urine. The presence of blood in semen, known as hematospermia, can be alarming but is often benign. However, persistent or recurrent cases require medical evaluation. Possible causes include prostate infections, inflammation of seminal vesicles, or trauma to reproductive organs. Blood in urine may indicate urinary tract infections, kidney stones, prostate enlargement, or tumors. Diagnostic evaluation may involve urine tests, imaging studies, and prostate examination. Early investigation ensures appropriate treatment and peace of mind for patients. Conclusion: sexual health symptoms often reflect broader medical conditions. Ignoring warning signs can delay diagnosis and treatment of serious diseases. Persistent erectile dysfunction, painful ejaculation, loss of libido, ejaculation disorders, penile curvature, testicular abnormalities, and blood in semen or urine are all symptoms that warrant professional evaluation. Modern urology and andrology offer effective diagnostic tools and treatments for most sexual health disorders. Seeking medical attention early allows physicians to identify underlying causes, initiate treatment, and help patients maintain healthy sexual function and overall well-being. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.